Hi there. Here we are. Today is August 10th, and we are all set here for another riveting session of Wondrous Roots, your health from the ground up. I'm Rebecca Becky Montrone. We have a business here in Keene called Wondrous Roots. I am an holistic healthcare practitioner and an herbalist. So I have a degree in holistic nutrition. I see clients in consultation for all kinds of health issues, from wellness to very serious things such as cancer, Parkinson's, Alzheimer's disease, and everything in between, type 2 diabetes, all kinds of things. I always welcome a challenge. So I meet with people in consultation, private consultation in my office here in person. And I also have many clients around the country and some out of the country who are, we do teleconference easily with Zoom. And I've been doing that since my beginning, the beginning of my time. Way back it was Skype, right? But or phone. It's always better if we can see each other. And I love doing it Zoom when I'm working with somebody with a distance between us, because I can share my screen like I do here. I'm doing these webinars. So thank you, students coming in today. It's a beautiful day. The storm has passed by through the night and it's really sunny out there. It's going to be a wonderful weekend. It already is. And so I thank you for taking an hour out to spend it with me here at your device, whatever you're viewing on or participating from. So speaking of participation, you can participate by typing into the chat. You can participate by raising your hand and I will call on you. And I promise I will look to make sure, try to be very sure to make sure that I see that. And then you can also participate by going to the Q&A, which is down somewhere. Mine is down at the bottom, both the raise a hand, the chat, the Q&A. You can type in there. You don't have to talk about what I'm talking about. You can ask me anything. I love fielding random questions about anything. I do that a lot for people who message me online and things like that. And I always enjoy a question about anything. If I don't have an answer, I'll be the first one to tell you I don't, but I will do all I can to find it for you. Okay, so and with that said, what else do I want to say? Here we are open in Keene, New Hampshire, where we are on Roxbury Street, which is one of the main corridors, one of the main conduits off Central Square. And we are up in the Miller Forge building, the old Miller Forge, the old mill building. On the third floor, we have free parking. We have elevator access, perfectly accommodating for anybody with a handicap. I'm always, when I do this, I'm always pointing at the door. As soon as you get off the elevator or the stairwell, our door is, when we're open, 9:30 to 5, Monday through Friday. Our door is open because we have an open shop and have a wonderful staff. And just come on up. We have plenty of things for you to take advantage of. We have a lot of wonderful nutritional supplements from third parties, but also from a lot of our own products, my own formulations. So I think with that said, I can introduce today's topic. So today's topic is polycystic ovarian syndrome, PCOS, and it's a problem that's very, very common today. And it's very, very troubling when women have this problem. Usually women find out about it when they're young. So as you start getting into, you're getting into puberty and you find out you're not getting your period, or you find out you're growing facial hair, or your scalp hair is falling out, or maybe you've got acne that doesn't seem to respond to be the normal. You can have hair growing on your upper arms or your belly, or maybe your upper thighs. These are kind of clues. You might have a problem with your weight, but not all people with women with PCOS do have a problem with their weight. So it can be very deceiving. So what I want to say is I decided to do this topic yesterday because as I was here in my office and preparing for an 11 o'clock formal consult appointment, one of my clients and, a mother and daughter came in, and they both are clients. And the daughter she just came up to me with a list and written in pencil. She'll be 18 in a very short time. And she had said, you know, something's not really right. And she had written down things like hair falling out, which she had told me about when we first met in November of 2023. And, you know, I didn't really pick up on PCOS with her at that point in time. So anyway, she came in and they had her food allergy results. And she comes from a family with a lot of food allergies. So, you know, her mom and I were kind of saying like, well, you know, you got to like avoid everything on this food allergy sensitivity list and then see what happens. But she was kind of really persistent. I give her a lot of credit with, well, no, look at these things. I have acne. My hair is falling out. She says, I'm bald. And her list kind of looked that way. So then I asked her about, you know, are you getting hair like in areas like your upper arms, your belly? She goes, yes, you know, blah, 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 blah. And it really did very much look in her profile, taking a stand back and looking at her again, because she's not overweight. And so that's kind of one of your big tip-offs, because not because if you're undisciplined and you're overweight, you're going to get PCOS, but because PCOS has a big factor or feature connected to it that has to do with insulin sensitivity or insulin insensitivity. So a lot of times people like that will have problems with their weight. I mean, it just makes sense. So she didn't fit in every way the classic profile. And even though she says she's bald, she's a lovely 18-year-old, and her hair looked good to me, but of course I don't know what her hair normally would be, right? So anyway, I told her mom I told them that I would try to pull this together for today, not necessarily for them, but just because I do work a lot with women with PCOS, young women, and I've had very good success. Recently, and I'll go into the protocol, but had women are typically told when they have PCOS that there's no cure, that we're going to put you on birth control pills, we're going to put you on spironolactone, we're going to put you on metformin for the insulin sensitivity and issue, and that there's really nothing, you know, you're probably going to have to go through fertility clinic and all of that kind of thing if you want to try to get pregnant at some point in your life. And I just want to tell you all, that's not my experience working with women with PCOS. So I jump on it. I jump at the opportunity to do that and to really show people that this is not a dead end. Of course, isn't how I am with many things. We're told in the mainstream, this is all we have in our toolkit. This is what we do. There is no cure. And here you go. You have been dealt this lot in life, and there's nothing you can do about it. So without further ado, I am going to share my screen. I always have to go through my little process here, as you guys know. Share, and then okay, this meeting is being recorded. Come on. Put my participants where you guys belong so I can see you. Put my chat where I can see it. Okay, so hopefully I'm keeping an eye on everything. And you can see there, PCOS, an effective approach. I wish I could do my PowerPoint when I do this, because I love the way the slides come up and there's just so much more pleasing, aesthetically speaking. But when I do that, I can't share the links that I go to. They don't show up. And so that's really the point of this, is to show you and to be teaching. So the links are important. So you just have to go with this kind of like scrolling method, which I don't love. Anyway, that's just my little rant. So here, what is PCOS? This is my little table of contents. Overcoming PCOS diet: vitamin D, fish oil, progesterone, folate, CoQ10, glutathione. Those of you who are familiar with me, and all of my regular attendees you guys are my regular students who just seem to are very faithful with your attendance record in the Wondrous Roots classroom. But you're going to see in this core program the same supplements I use as core, with so very many different areas of health. And again, that's the wonderful thing, because that shows how powerful those core items are, how wide ranging they are in their application to the root level of health, right? It just proves it out. It just demonstrates it over and over again. It's the same wondrous roots that must be nourished to then overcome so many things. So you don't have to do, oh man, I have diabetes and I have cancer, or I have PCOS and I have an autoimmune illness. Well, there are going to be differences based on those things. There's going to be some changes, some individualistic changes in your protocol, but the core is going to be pretty much the same. So that's really a really wonderful thing, because if you're doing these nutrients, say because you have PCOS, you're also preventing cancer. You're also preventing dementia. You're also preventing type 2 diabetes. You're also strengthening yourself against cardiovascular disease. So it's really awesome. It's just great. It's wondrous, just really wondrous. Okay, so then we're going to go through all of these, kind of hit on those. And then, like I did with cancer last week, I am going to have there for you that you can look at yourself, you can put into use. You don't have to meet with me to do it, and you can share it with others, because if you don't have PCOS, you probably know somebody who does. And because it is so very prevalent today, Dr. John Lee, who I'm going to be using a lot of his material today. I've referred to him before in the past when I did my presentation on progesterone, and maybe at other times, but he really is, in my opinion, the salient expert out there when it comes to many of the hormonal things in the bioidentical hormone world. And he really is a PCOS expert. So I'm going to be using quite a bit of his stuff. And he's the one who says he puts this at epidemic proportions right now. We're going to talk about why that is. And again, it goes back to some of the not so wondrous things in our current, the environment in which we live, the foods we eat, the air we breathe, the water we drink, the things we put on our skin, et cetera, et cetera. All right, so some people might not even know what PCOS is. So PCOS refers to multiple cysts on the ovaries and a host of other problems that go along with them, including anovulation. So you're not ovulating. That's the main problem. You're kind of coming up to ovulating, but you don't. And then you end up, your ovary ends up looking like a pomegranate with all of these mature follicles that never release an egg. In fact, remember when I did the pomegranate presentation? You can go back to that on my website, but if you go to the pomegranate, if you look at pomegranate, is very good for hormonal health. It's very good for, we saw in that presentation and the information pointing to it being very good for menopausal things, so for hormonal things. And a lot of times the doctrine of signatures in the world of botanical medicine says that something about the plant demonstrates what it does for us, and actually that the seeds within the fruit of the pomegranate can look like these follicles within the that contain the oocytes, or the ova within the ovary. Okay, so anyway, lack of ovulation and menstrual abnormalities, hirsutism, which is the growth of hair in places where women shouldn't have it, the facial hair. You can have facial hair here. You can have, like a mustache, belly, upper thigh, upper arms. That's what I was talking about. Male pattern baldness. So a lot of women, while they get the hair where they don't want it, they don't have the hair where they do want it on their head. Acne, and often obesity. Such women may also have varying degrees of insulin resistance and an increased incidence of type 2 diabetes. Unfavorable lipid patterns, usually high triglycerides. And when people talk to me about their lipid levels, they say, oh, my cholesterol's high. I'm like, your cholesterol's not high. I'm like, what are your triglycerides? That's the main thing I like to look at, because that shows a problem with insulin sensitivity and pre-diabetic kind of stuff, right? So, and a low bone density. Laboratory tests often show higher than normal circulating androgens, male hormones, especially testosterone. Now, women need testosterone. Testosterone plays a role in women's hormonal health, but this is like too much. So again, some of the things we see: ovarian cysts. So you see here, these cysts are forming here. This is the healthy ovary. This is the one that is not. Irregular periods. Some people just never get a period, or they'll get a period every year or every 6 months. It's just very acne. Obesity, trouble losing weight, pelvic pain, fatigue, male pattern baldness, thin hair, hair growth, low libido, insulin resistance, high testosterone should be level, and infertility. And this is from John Lee here. So he says, in the 30 years that I practiced medicine, I rarely saw a woman with polycystic ovarian syndrome. Today, estimates are that 10 to 20% of women have PCOS. And I would guess that among young women, the number is even higher, qualifying this as an epidemic. I have had many emails and letters from women in their late teens and 20s with PCOS. Their doctors tend to prescribe 2 treatments, both of which affect symptoms only, and neither of which is particularly successful. One treatment is temporary chemical castration using either birth control pills, androgens, male hormones, androgen blockers, synthetic estrogens, Lupron, or similar drugs that block hormone production. The other is prescribing the new oral drugs for type 2 diabetes, which reduce insulin resistance. I have a much safer, simpler, more effective, and less expensive approach that treats the cause and not just the symptoms of PCOS. And when you are able to access this, which will be on my PCOS page after I get my video up later, probably this evening, that page will be updated. I'll send out an email like I do to announce the webinar. And then you'll be able to see this whole PDF. But again, there's a lot of great information by John Lee here on this page. It's kind of a good overview. It's not too long, but it's really good. A lot of good information there. Okay. So failure to ovulate, and I'm going to go through because some of you might not be familiar with what happens during the menstrual cycle from day 1 to day 28. I've got a really great chart that I'm going to show you in a moment, but it happens in the brain. It all starts in the brain. So PCOS occurs when a woman doesn't ovulate, which causes a disruption in the normal cyclical interrelationship among her hormones, brain, and ovaries. Normally, the hypothalamus, a regulatory center in the brain, monitors the hormone output of the ovaries and synchronizes the normal menstrual cycle. When monthly bleeding ends, the hypothalamus secretes gonadotropin-releasing hormone, which stimulates the pituitary gland in the brain to release follicle-stimulating hormone and luteinizing hormone. These hormones direct an ovary to start making estrogen, mostly estradiol, and stimulate the maturation of eggs in about 120 follicles. So we're getting those follicles ready to go. So these oocytes, which we have at birth, women, we have them in our ovaries at birth, but they're not mature. So anyway, the first follow. Let me just move that so make sure I can see everybody here. Let me move things around on my desktop for a second. I don't want to miss anybody. The first follicle that ovulates, releasing its egg into the fallopian tube for a journey to the uterus, quickly changes into the corpus luteum, which is a factory for making progesterone, and raises progesterone concentrations to 200 to 300 times higher than that of estradiol. This is huge. Progesterone is so huge in this picture, and it's easy to do. It's easy to get that in there. This huge surge of progesterone simultaneously puts the uterine lining in its secretory or ripening phase and turns off further ovulation by either ovary, right? Because you don't want to have quintuplets. If fertilization does not occur, the ovary stops its elevated production of both estrogen and progesterone. This sudden fall in the concentrations of these hormones causes shedding of the blood-rich uterine lining, and bleeding, which is menstruation. Then in response to low hormone levels, there is a rise in gonadotropin releasing hormone, and the cycle starts all over again, stimulating estrogen, an uptick in estrogen, an uptake in luteinizing hormone, an uptake in follicle stimulating hormone. So it all starts over again. But for the brain to get this right, it needs for the whole thing to work properly. The missing thing when women do not ovulate, so when you get right there to release that egg and it doesn't release, what does it do? It forms a cyst, but it doesn't release. And the brain is very confused. It's very confused. It doesn't know what the heck is going on. And it in turn releases excess androgens, male hormones. So it all makes sense. So again, PCOS begins in the brain. Most evidence points to a neuroendocrine basis for PCOS, meaning that dysfunction in the brain, especially in the hypothalamus, is the main cause of ovarian androgen excess. It works like this. In a normal, healthy menstrual cycle, the hypothalamus releases pulses of gonadotropin-releasing hormone, first slowly, then more rapidly, and then slowly again after ovulation. In turn, those pulses stimulate pituitary hormones, FSH, and follicle stimulating hormone and luteinizing hormone that coordinate ovulation and promote the healthy production of estrogen and progesterone. That's all working to build the uterine lining so that the uterine lining is where it needs to be to receive a fertilized egg. I personally had several, probably 5 early miscarriages because I have a luteal phase defect. And if I had known back then what I know now, I probably could have fixed that, but it's all good. But what I will say is, so you need to have those hormones in the right balance. So what happened with me was I did not make enough progesterone in the second half of the cycle, and I'll show you my chart in a second. A key feature of a healthy neuroendocrine system is progesterone's beneficial slowing effect of the gonadotropin releasing hormone pulsatility. In other words, progesterone made by ovulation exerts beneficial negative feedback on the hypothalamus, lowering androgens and promoting future ovulation. So when that doesn't happen, the androgens are not lowered. Hence the hirsutism, the hair on the face, the acne, the male pattern baldness. It all makes sense. So here, I love this. And if you have been in my office talking about the menstrual cycle, okay, I think that's the best place to be. This is so much better, right? Because I do it on my whiteboard. And I actually, oh gosh, I've got it there. I wonder if I can just take my camera and show it to you without screwing things up. I'm going to try. All right, because this is going to show the difference in how much better this is. And see, I have a really nice monitor, thanks to my husband here, that I can turn and show my clients. So this is a lot better. But here, I'll take this off for a second. Okay. Now, yeah, I can't really zoom in. Anyway, just take my word for it. It's pretty pathetic. Hopefully that's back in place. Anyway, this is really great. Okay, so here you go. You're at day 1. This is the day when you first start bleeding. That's day 1 of your cycle. It starts a whole new cycle. You feel like it's at the end, right? But it sort of is at the end, but then it's immediately at the beginning. So here you have, so this is a follicle within an oocyte in it, an ova, an egg. And it's starting to ripen. So here you are, around day 10, 11, 12, everything's the follicle's getting bigger. Around day 14, that's typical. That's mid-cycle. A lot of times when women ovulate, you might feel some ovarian pain. I used to feel that almost every cycle. They call it Mittelschmerz. So it's German for pain in the middle of the cycle. So that egg comes out. This is such a better drawing than mine. Now this follicle all of a sudden becomes the corpus luteum. The corpus luteum's job is to increase progesterone. Now, right around here, it needs to be getting, the corpus luteum needs to be getting a signal back from the uterus that there is an embedding fertilized egg. And this was my problem with miscarriage, if there's not enough of a uterine lining to allow that embedment to take root as well as it should, although, mine would go on for several weeks and then I would, it would just collapse. But in any case, if there's not a signal that comes back, the progesterone level, the corpus luteum starts, shriveling, the progesterone level is less, it's less. And here at day 28, all your hormones are flat. Your estrogen, your FSH, your follicular stimulating hormone, your LH, luteinizing hormone, your progesterone, everything comes back down. And this signals the uterine lining to shed. And that's what brings on the bleeding here on day 1 of the cycle. Okay, so anyway. Why eggs won't pop and progesterone isn't made. But what causes dysfunctional follicles that won't release eggs? John Lee says, I am convinced from wildlife studies and from what I have observed in my practice that it is due to the exposure of female embryos. Okay, so he's saying we women, when we were in our mother's womb, the environment wasn't as good as it should be. And I'm not sure if that's in my case or everybody's case, but I would say probably more so now in the generation that's coming up, the teenagers today, the young women we have this epidemic going on. I would say this is probably right on, that it's having this effect. And I will tell you, I know that, well, I'll tell you that in a second, because I haven't even said what it is yet. The exposure of female embryos to xenobiotics, right? Synthetic estrogens, environmental pollutants, which chemically act like estrogen on the developing baby's tissues. I talk about them a lot. They're in our soft plastics. They're in our plastics. They're in microwaved food that's wrapped in plastic, high amounts. They're in other things we'll get to in a moment, but they're in our sunscreens. We are really very surrounded by xenoestrogens. We are exposed to very many of them. It's not good. So anyway, when a female embryo develops in the womb, 500 to 800,000 follicles are created, each enclosing an immature ovum. Studies show that the creation of ovarian follicles during this embryo stage is exquisitely sensitive to the toxicity of xenobiotics. Women getting ready to conceive, pregnant women, avoid xenobiotics. Get them out of your food, get them out of your cosmetics, get them out of your, just get them away from you, and be very strict. When the mother is exposed to these chemicals, she experiences no apparent damage. You're not going to notice a thing, but the baby she is carrying is far more susceptible, and these chemicals may damage a female embryo's ovarian follicles and make them dysfunctional, unable to complete ovulation or manufacture sufficient progesterone. This damage is not apparent until after puberty. So you're never going to know that until you hit the age of menstruation and things don't go right. Again, that is in that same article by John Lee that I showed you, but you can open it up again. So what are xenobiotics? Again, chemical substances which are alien or unnatural to the animal and human life. Xenobiotics include plant components, pharmaceutical drugs, pesticides, cosmetic products, added food flavors, fragrances, etc. Plant components, think about that. I talked about that in the Parkinson's presentation because we talked about paraquat and rotenone. Paraquat actually comes from chrysanthemum. And so we would think, oh, it's a natural fertilizer. It's a natural pesticide, but it's natural. So it's got to be fine, right? No, no, just because something's natural, there are many natural poisons. Probably all poisons eventually go back to natural things. So don't be fooled by if it's natural, it's perfectly harmless. That's not true. Okay. At higher constant, okay, xenobiotics include plant components, pharmaceutical drugs, pesticides, cosmetic products, added food flavors, fragrances, etc. At higher phthalates, PHTHALATES, very hard to spell, but once you get it, I don't know, and to pronounce phthalates. Anyway, at higher concentrations in environmental matrices, naturally occurring substances, endobiotics, may also be considered as xenobiotics. Xenobiotics are categorized as pesticides, pharmaceutical chemicals, so a lot of drugs people are prescribed. Personal care products, illicit narcotic drugs, substances, industrial, commercial goods, and nuclear waste can be present in various environmental matrices. Xenobiotic sources. This is a horrible slide, but I couldn't get anything that said it the way I wanted it to. That was clearer. Anyway, fossil fuels, plastics, industrial feedstock. So again, industrial feedstock, right? That why, well, grass-fed, don't be, so bougie. Don't be so, don't be a food snob. It's not about being a food snob. It's like, yeah, you don't want them fed grain that contains alkanes and alkenes, if you will. Gasoline oxygenates, paint, solvent, degreaser, coolant fluid, fumigant, plastics. We are plastic happy society. Explosives, fossil fuels, solvents, industrial feedstock, again, by BTEX is in that. Pesticides, dyes, pigments, pharmaceuticals, explosives, pharmaceuticals, pesticides, dyes, these different things. Wood preservation, pesticides, pulp bleaching. So they abound in our environment. So what do? Again, Becky uses a slap it silly approach, addressing all factors involved as we understand them at the same time. As we understand them, I should put a comma there. I'll redo it before I post this up, but at the same time. So, right, we don't just do progesterone. We don't just do melatonin. We don't just do herbs. If we want to really get a result, we do everything. So here we go. What are we going to do? Diet is key. I had one young woman. She's not from this area, and I've only had one session with her, and I know she will not be watching this, so I will not mind saying this, but she was very upset. She clearly had PCOS. She was very upset with her skin. She was very upset with things. And when I told her about the diet, that the big thing with PCOS is you have to avoid refined carbs, not carbs. You need whole complex carbs and sugar, because it's an insulin resistance problem. And the diet is really huge. She just kind of giggled and said, well, I love sugar. But she was whining about her acne. And it's like, you got to take it seriously. You can't say, well, I have this, but I love my sugar. Well, okay, we'll have that then, because you're going to have it if you're not willing to change your diet. So you got to be serious. You got to do your part, or the supplements and things will help. But if you're going to be eating a diet that's loaded with xenobiotics and loaded pesticides and things, if you're going to be eating processed food, which is laden with those things, if you're going to say, well, I just love sugar, aren't I cute? No, you got to not love sugar. And the diet connection to PCOS. By far, the biggest lifestyle contributor to PCOS is poor diet. Young women with PCOS tend to eat far too much sugar and highly refined carbohydrates. These foods cause an unhealthy rise in insulin levels. According to Geraldine Pryor, MD, insulin stimulates androgen receptors on the outside of the ovary, causing the typical PCOS symptoms of excess hair on the face, arms, legs, thin hair on the head, and acne. Eventually, this type of diet will cause obesity, which will cause insulin resistance, the inability of cells to take in insulin, which will aggravate the PCOS even more, and I might add lead to type 2 diabetes. The androgens also play a role in blocking the release of the egg from the follicle. So it is a vicious circle. If you don't ovulate and make progesterone, the hypothalamus is confused and does not bring down the level of androgens like it's supposed to. And the androgens are more prevalent, and at the same time, because of that, it stops in your subsequent cycles. It just is like a vicious circle. It inhibits the follicle from releasing the egg the next time. So it's just really, that's how it happens and how it just perpetuates. Women who have a high number of dysfunctional follicles to begin with due to xenobiotic exposure in the womb will have worse problems if their diets are high in sugary foods and low in nutrition. So the diet is key. And guess what? If you clean up your diet, your body will thank you in so many ways. You will blossom in ways that you had no idea were related to your poor diet. And you might think, well, I'm just eating the typical diet, the typical Western diet. Well, that's the problem. Okay. We'll have worse problems if the diets are high in sugary foods and low in nutrition. Since this is exactly the type of diet favored by teens and young women, it's easy to understand why there's so much PCOS in that age group. 50 years ago, the average person ate 1 pound of sugar a year. Today, the average teenager today eats 1 pound a week. And I know, Brud Hodgkins, you're with me in the classroom today. And I just want to say, this is a big, this is dear to your heart. You're talking with me about this all the time, trying to get proper nutrition into the schools, and to young people and sports teams and all of that kind of thing. And Brud, by the way, is he's the founder of Indoor Organic Gardens of Poughkeepsie, and he is the source of our sulforaphane veggie powder, which is broccoli sprout and radish sprout. Really wonderful product for many things. And I'm sure it would make a big difference here too, although I don't have it in my list. It's always fantastic for everything and a great source of glutathione and antioxidants, which play a huge role in polycystic ovarian syndrome. But look at that. Average teenager today eats 1 pound of sugar in a week. So parents, think about what you're letting pass, and don't let your little kids get hooked on that stuff. They won't develop a taste for it if they don't have it. Fruit will be sweet. Healthy, sweet foods will be delicious. And if you ruin their taste buds with hyper sweetened, refined sugar stuff and processed foods, they're not going to want the healthy food then. So don't say, don't give in. And this is a really good page. I'm going to open that one. PCOS diet, why food matters and how to, and I really evaluated different pages telling me about the right diet for PCOS, because this is the one I agreed with. Because sometimes you get mixed signals, and I like this one because it really does include the complex carbohydrates, but it doesn't overdo them in the whole picture. So why food matters, appetite dysregulation and weight struggles, how the PCOS diet works, what to eat. This is really good. Every meal should include, right? Protein, a palm size of animal protein, fish, poultry, 2 eggs, or a ½ cup of beans, legumes. Okay, so not green beans, but legumes. Healthy fats, 1 to 2 tablespoons of olive oil, a tablespoon of ghee or coconut oil, or 1/2 avocado. Veggies, 1 to 2 cups of veggies or combination of veggies and fruit. That, I would say, is a great diet for just about anybody. And then plus every day aim for 6 to 8 servings of vegetables. Like how many, I'm sure that teenager I was talking to, that college student, was not, that would be like shocking to her. Up to 1 to 2 servings of low glycemic index fruit. So berries are fantastic for that. A 1/2 cup of slow carbs, 1 or 2 times daily. So brown rice, quinoa, maybe sweet potato, that kind of thing. Slow carbs would also be legumes. Although they're protein, they're also slow carb. About an ounce of nuts or seeds, or a tablespoon of nut seed or nut or seed butter. And then again, being pure with your foods, right? You're going to have to eat less better quality food if budget is a problem, because You can't, if you're going to eat Skippy, just don't have the peanut butter, okay? Because Skippy's got sugar and all kinds of crap in it. So just be careful of your source. Below, you'll meet the energy rock stars, protein, fats, and slow burning carbohydrates, slow carbs that in the right amounts and at the right times keep your blood sugar steady, your energy humming, and your hormones happy. I would recommend this really for anybody for hormone health. So anyway, she goes into, really good stuff here. Slow carbs, healthful grains, brown rice, millet, oats, rolled and steel cut. Oh, good. I'm reading an awesome book my sports psychologist son gave me called Spark. Susan is telling us all related diet and exercise for young people and start the healthy habits young. Amazing what exercise and healthy nutrition could do for the brain. And I'll bet you Brad knows that book. Excellent. Spark. I'm going to check that out. Everybody hear that? Spark. It's all related diet and exercise for young people. Wow. We need a bringing all of that back. Eat more plants. Oh, okay. All right. This is really excellent. So please, when I get this up, pick up the PDF, really go through this. For hormonal health, this is a great diet. I totally endorse. Okay. And I promise you, if you have a weight problem, that'll make a big difference. Hormones play a big role in weight gain. Well, of course, we're talking about that insulin insensitivity and PCOS. It's all connected. Supplements for PCS, and I say forget the birth control pills, spironolactone, metformin, et cetera, et cetera. And I want to tell you something. I have very good success with this problem. I would say virtually everyone I've personally worked with responds quickly. So I had two women in recent, like over the last 2 years. So one was trying to get pregnant, had not had a period in over a year. So we followed this protocol, and I do the progesterone challenge, which I'll explain in a moment. And the first month, she got her period. And we were like ecstatic. And I tell people, don't look for this to happen the first month. You haven't menstruated in months and months and months, maybe years. So don't get bummed out if it doesn't happen right away. But she did. And so we were very excited. So she followed the same protocol the next month, and she did not get her period. And we were very bummed. We were like, well, just hang in there. Wait and see what happens next month. Well, come to find out, she was pregnant. She had a very healthy baby. So I had another woman, same thing. She had PCOS. She had had an ectopic pregnancy. So that's like when your fertilized egg attaches to the fallopian tube. It doesn't make it into the uterus, and that's like ectopic. Okay, they can be very dangerous. But anyway, she had one. And that's not unusual for someone with that hormone, PCOS kind of thing. And she had that. She had been told by her doctor she probably would never have a healthy pregnancy. And I will tell you, it was probably 2 or 3 months. I mean, she immediately felt much better with her emotional stuff, her mood things, because hormones all play into that. But within a few months, she too was pregnant and was very surprised, and has given birth to a beautifully healthy baby. So you're told, you go to the doctor, you're going to have to go to a fertility clinic. You're going to have to use, hormone driving things, letrozole, and you name it, to produce multiple eggs, and spend a lot of money, and horrible side effects to these drugs, and some particularly concerning. I had one woman who was prescribed letrozole, which is an aromatase inhibitor, which is typically used in a fertility clinic these days. And she ended up with a severe irreversible rheumatoid arthritis. We know letrozole can really affect the immune system, but that was a severe case, but it ruined her life. She was just trying to get pregnant. So you want to avoid the fertility clinics. You really do, if you can. Not saying they don't work, not saying people don't have good results, but there is a better way. And they also kind of overdrive things. They don't fix your system. They just try to say, you have a broken system and we'll just plow through it and overdrive it. And we'll get you that baby. So anyway, vitamin D, like it does in many things. Now I have here, and this is for ease of use. You don't have to use the supplements that I have links to. This is just to make it easy. So if you have a great brand of vitamin D3, K2 that you like, that you get from somewhere else, I don't care. This is not like, oh, wow, if I do this, somebody's going to buy D3 and K2 from me. I mean, I appreciate everybody's business, but that's not the point. But again, if you click on the images, it's going to take you to a product. So that you can see it and you can see what I'm talking about. And if you want to say, I want to treat my PCOS and I'm going to follow Becky's protocol and I'm just going to load my cart and do it, you can do that too. But anyway, vitamin D deficiency appears to occur frequently in women with PCOS and may be a contributing factor to some of the biochemical abnormalities seen in this condition. Here we have the role of vitamin D in polycystic ovarian syndrome, number 1, because I have another slide about it coming up. Vitamin D plays a physiologic role in reproduction, including ovarian follicular development and luteinizing via altering anti-Müllerian hormone signaling, follicle stimulating hormone sensitivity, and progesterone production in human granulosa cells. It also affects glucose homeostasis through manifold roles. Okay, so blood sugar. The potential influences of vitamin D on glucose homeostasis include the presence of specific vitamin D receptor in pancreatic beta cells and skeletal muscle, the expression of 1-alpha hydroxylase enzyme that can catalyze a blah, 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 and the presence of a vitamin D response element in the human insulin gene promoter. So vitamin D is not a vitamin, really. It's a hormone. And it is super important for so many of our hormonal doings in the body. And here, having a direct influence on blood sugar control. Then you can see that if you want to go there and see that more. And here's number 2, the role of vitamin D in polycystic ovarian syndrome. Plays a physiologic role in reproduction, including ovarian, okay. Oh, it looks like it's the exact same thing from 2 different sources. So when I redo this, I'll just eliminate one of those slides. Okay. Okay, fish oil and fertility, a surprising connection. Omega-3 fats are effective at improving many aspects of PCOS, including the high triglycerides we talked about, that lipid anomaly, and mood, and help to support a healthy pregnancy. Because really, a lot of times do you only want to treat PCOS because you want to have a baby? No, I don't care if you are a nun and you're never going to get married and you're never going to have sex and you're never going to want to have a baby. If you have PCOS, you need to fix it because you're all off. You're off and it needs to be fixed. I had one young woman who is an actor, and she was in a play at the time she came to see me, and she goes, do I have to fix this if I don't want to get pregnant until I want to get pregnant? Because, it's really nice because when we're on stage and all the other women have their periods, I don't, and it's a lot easier. I'm like, no, suck it up, honey. You got to bleed like the rest of us, but you need to fix it whether you are going to, whether you're wanting to conceive or not. You need to have hormone balance in your body to be healthy. Benefits of omega-3 fats for PCOS. Omega-3 fats are essential for people with PCOS as they provide numerous health benefits. Omega-3 fats are linked to improving triglycerides and insulin levels, lowering inflammation and blood pressure, and even providing better hair and skin quality and improving your mood. DHEA is particularly important during pregnancy as it aids in the baby's brain development. Exciting new research from the American Society of Reproductive Medicine Scientific Congress showed omega-3s are beneficial for improving fertility and chances of conceiving in PCOS women. Previous research that looked at 18,000 nurses from the Nurses' Health Study showed that omega-3 intake was associated with better fertility. It makes sense. Now, progesterone. I have a whole page on progesterone too on my website. It's right under PCOS in the index. But anyway, when ovulation does not occur, okay, I talked about that. There is no corpus luteum, progesterone is not produced. This confuses the brain, excess androgens are secreted. We can use a progesterone challenge using bioidentical progesterone to trick the brain into thinking ovulation has occurred. For women not menstruating regularly, this will often bring on a normal cycle. So this is what we do. I'm going to go back up to my chart. that beautiful diagram of the cycle. So this is what I have women do. They can use, you can use a progesterone cream, you can use a progesterone suppository. Those are things you can get over the counter. You can get, this is the bad thing, right? So I have a woman I just worked with, this totally different woman than one I've talked about, but 2 weeks ago, I advised her on this. She was the daughter-in-law of a client of mine. And so I just said, look, I'll tell you what to do. So they have her on Provera as a progesterone challenge. Well, Provera is synthetic progesterone. And should she get pregnant, this is part of her fertility treatment. Should she get pregnant while on Provera, Provera causes birth defects. The synthetic hormone is not it's a progestin. It's not progesterone. It's not the same as the progesterone your body makes. So this is crazy. But anyway, we use a bioidentical progesterone. It's exactly the progesterone your body makes. And so it's really wonderful for the body. It's great for pregnancy. It's wonderful. The placenta, okay, so you're making during your luteal phase here, up here, you're making 12 to 20 milligrams a day of progesterone from the corpus luteum. When you hit week 14 of your pregnancy, the placenta takes over the production of progesterone and cranks out 300 to 400 milligrams a day. That's why women typically in the second and third trimester, until they get so big they're uncomfortable with heartburn or whatever, if they have that kind of thing, feel mentally, they just feel really great when they're in the second and third trimesters of pregnancy. And this absolutely ensures that you're not going to lose the baby due to a progesterone deficit. But anyway, so what I do is I have women, okay, so say a woman has not had a period for a long time. She has no idea. She's not where she is in that, where she is. So I just say, take any arbitrary day and call it day one. And then wait till you're right around here, 12, 13, 14, and start using 20, 25 milligrams of progesterone morning and night. Either my options that I have recommended here are a cream and suppository. But anyway, and then start using that. And so now what you're doing is you are raising your progesterone. Your hypothalamus is getting the idea that you ovulated, even though you didn't. And then you're going to continue your progesterone right up to day 28, and you stop. This is called the progesterone challenge. And it will often bring on a period. But again, I tell people, just if it does, then you're back to day one, the day you get your period, and you just keep doing it. And then if it doesn't, you call day 29, day one, and you just patiently keep doing it. And just keep doing it. Keep tricking your brain into thinking you ovulated, even though you didn't. I love tricking. So fun. Okay. And those are two options. If you click on those, you can see those. Okay. And this is John Lee. Back to Dr. John Lee. There are several reasons why doctors don't recognize the role of progesterone deficiency in PCOS. They may not be aware that the hypothalamus responds not only to the rise and fall of estrogen, but also to the rise and fall of progesterone. Since standard tests usually indicate that a woman with PCOS has plenty of estrogen and she is still having periods, the doctor assumes she is still ovulating and producing plenty of progesterone. The odds of a woman having estrogen dominance and progesterone deficiency, we've talked about this a lot, rise to 50% in the female population by age 35, yet doctors rarely measure progesterone concentrations. They may fear giving progesterone because of all the side effects caused by synthetic progestins, which I just talked about, and may not be aware that natural progesterone, unlike synthetic progestins, is remarkable free of side effects when given in normal physiologic doses. You can actually give them in very high doses, very beneficially. But you don't have to do this. Folate and vitamin B9. So these are super, super important. I have here like the Thorne-based basic prenatal which I really like, and it has adequate folate. The form of folate is super important. It cannot be folic acid because a lot of us cannot use folic acid. And if you have PCOS, you're probably greater chances that you probably have an MTHFR defect and you can't. So that's a subject I've talked about too. This product I love. So OvaBoost has myo-inositol, it has folate, it has CoQ10, it has melatonin, 2 milligrams, alpha lipoic acid, and grapeseed extract, high antioxidants here. All 4 of these, very high antioxidants. CoQ10 has been shown to slow down the aging of eggs, of ovum, and oocytes, whatever you want to call them. But the biggest problem with infertility when people are getting into their 30s is old eggs. And so we have a few things that we can do to reverse the timer, reverse the biological clock. And CoQ10 is one. Glutathione is the biggest. I got to say it. I always get to say it because glutathione is like, it's related to everything, isn't it? If you've listened to me at all, it is totally related to like everything. And Susan has her hand up. Oh, I'm so glad I saw that. Susan, are you there? Susan? Ask to unmute. Okay, I'm supposed to ask you to unmute. I can't hear you, Susan. Oh, Susan? I know my speaker is on. I tested it. Let me just hang on one second. Make sure. Yep, I can hear. So I can't pick you up, Susan. So sorry about that. Susan? All right. I'm sorry. Type into the chat. You're really good at that. Okay. All right. So antioxidants are very, because oxidative stress, reactive oxygen species damage the eggs as well. So role of melatonin in polycystic ovarian syndrome. This has to do with, especially with the androgens, but these strong antioxidants. So polycystic ovarian syndrome is a widespread endocrine disorder affecting approximately 20% of women within reproductive age. It is, okay. Susan her phone was in her pocket because she's gardening while she's listening to this. And she hit the raise her hand. Okay, that's mystery solved. So it is associated with hyperandrogenism. So lack of, okay, right. So melatonin is the main pineal gland hormone involved in the regulation of the circadian rhythm. In recent years, it has been observed that the reduction in melatonin levels of follicular fluid exists in PCOS patients. So let me just do this. Okay, if I do this, it's going to show on my screen. Is she showing on my screen? I think. Susan, if you can do me a favor and like fix your phone because you're like on and we're getting background noise from your phone. No. Okay. Let's see if I stop my share. You do see me. Okay, I just don't, because sometimes in the video it just comes up with that person's name and a blank screen. But okay, so I'm going to share my screen again. Technical difficulties, but they're not that difficult. Okay. I have to go back now to my participants, my chat. Okay. Melatonin receptors in the ovary and intrafollicular fluid adjust sex steroid secretion at different phases of ovarian follicular maturation. Moreover, melatonin is a strong antioxidant and an effective free radical scavenger, which protects ovarian follicles during follicular maturation. Melatonin and PCOS. Melatonin lowers the androgen levels. Just going to remove you, Susan, for a second because it might mess up my video. And then just get back on. Oh, no, I'll cancel it because you can't rejoin. Okay. Melatonin and PCOS again. Okay, there we go. Melatonin reduces androgen production and upregulates such and so expression in granulosa cells from PCOS patients. So basically, melatonin is really dealing with the androgens, so the facial hair growth, right, and the baldness and the acne and stuff like that. But it's also a potent antioxidant. So you could always take more of that. There's 2 milligrams in the OvaBoost. Oh, I know. I wanted to take you to OvaBoost. This is something you're going to want to look at just to see how it works. This is a really good, tell me more about OvaBoost. Okay. A trio of ingredients, myo-inositol, folic acid, also called folac, not folate, and melatonin, CoQ10. It tells how those things work there. And then also here. Inositol, myo-inositol is awesome. In patients, as a novel method for ovulation induction, myo-inositol is a simple and safe treatment that is capable of restoring spontaneous ovarian activity and consequently fertility in most patients with PCOS. This is a clinical trial, so there's real substance there. And this therapy did not cause multiple pregnancy. Inositol is also an important nutrient for OCD, anxiety, and depression. And a lot of times those things are present in somebody with PCOS, not because they're bummed out because they have PCOS. It's just part of the whole hormonal disruption. And then efficacy and safety of CoQ10 supplementation in the treatment of polycystic ovary syndrome, a systematic review and meta-analysis. It says, based on the current evidence, it could be considered that the addition of CoQ10 is a safe therapy to improve PCOS by improving insulin resistance, increasing sex hormone levels, and improving blood lipids. But the reason like it's in the OvaBoost is because of its antioxidant potential. And that's super cool. So glutathione. For women with PCOS, glutathione is also exceptionally important. A recent study challenged a group of 36 lean women with PCOS with a load of glucose. As would be expected, the women produced higher levels of insulin and testosterone in response to the dose of sugar. The study concluded that the glucose caused a significant increase in the oxidative stress markers, lowering the glutathione levels, and this reduction in glutathione was associated with an increase in testosterone. And then glutathione, fertility, and pregnancy. Before pregnancy, glutathione plays, oh, I actually wanted to go here. For women with PCOS, okay, there's that. Another study that set out to evaluate DNA damage in the ovaries of women with PCOS concluded that there may be significantly less glutathione in the ovary as a result of the condition. As many women with PCOS have seen when trying to conceive, egg quality is a key issue. Even for those women with PCOS who ovulate regularly, the time to conceive can be long, most often related to the quality of her follicles. Glutathione is protective for the egg quality of women with PCOS, and increasing these levels can not only improve the chances of conceiving, but can also increase the general rate of ovulation. So that's really huge. And again, sulforaphane plays a role in that process. In addition to directly taking acetylglutathione. Now, sodium butyrate. I did a program on butyrate not long ago, but look at this. Rats with PCOS were characterized by elevated levels of plasma insulin and testosterone, increases in plasma and hypothalamic triglyceride levels, inflammatory biomarker, apoptotic marker, and decreased plasma gonadotropin releasing hormone were observed. Additionally, a decrease in hypothalamic GABA was revealed. Nevertheless, the administration of butyrate attenuated these alterations. The present study suggests that butyrate ameliorates hypothalamic inflammation in an experimental model of PCOS, a beneficial effect that is accompanied by enhanced GABA production, which is also going to make you feel better. I've done a whole thing on sodium butyrate, excellent for your mood, for your neurotransmitters, excellent for your gut. The gut is very important in this situation, as in all situations. And here we have butyrate alleviates renal inflammation and fibrosis, kidney, in a rat model of polycystic ovarian syndrome by suppression of SDF1, which I take is not good. the present investigation demonstrates that PCOS declines your kidney function, which is accompanied by renal inflammation, apoptosis, and fibrosis. The study further suggests that butyrate restores renal function by suppressing renal blah, 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 with subsequent attenuation of renal. So here we go. Iodine, I have everybody, right? Iodine plays an essential role in the production of the thyroid hormone. Because the body does not make iodine naturally, it is essential to get adequate supplies from your diet. While iodine plays an important role with the thyroid, it also plays an important role in reducing polycystic ovarian syndrome risk and severity. And remember, it is the great estrogen metabolizer. So additionally, iodine deficiency negatively affects folliculogenesis, so the process in the maturation of the ovarian follicle into a fertilizable egg. This impact has been found to play a role in leading to PCOS onset. So again, we're all iodine deficient, if not supplementing. Another big problem with our young women today. When low iodine levels are present in women, thyroid activity becomes unbalanced and irregular. This lack of thyroid hormone production and release into the bloodstream is known as hypothyroidism. In short, if the thyroid has low iodine, hormones aren't produced in proper amounts. And when it comes to fertility, the ovaries can struggle. Because of the exchanging role PCOS and hormones play on each other, it's common for women with PCOS to have higher incidences of thyroid disease or an enlarged thyroid or goiter. But there's also the whole thing about the estrogen. Dealing with the estrogen, iodine is doing that as well. Magnesium and PCOS. A study conducted at the State University of New York found significantly lower serum magnesium levels in PCOS women compared to non-PCOS women. Again, going back to these core nutrients, I ranted and raved about magnesium many times. Magnesium plays a role as a cofactor in some major processes in the body. It's involved in insulin and glucose signaling, and magnesium is needed to regulate heart contractions, just to name a few important functions. Having a deficiency of magnesium has been shown to increase your risk for developing type 2 diabetes and associated with worse health outcomes. Here's what women with PCOS should know about magnesium and how to best maintain optimal levels, and you can go to learn more. Trace minerals and PCOS. So I have the Thorne basic nutrients 2 per day there, although I had put up there previously like the prenatal. You don't have to use prenatal. Say you're not even, you have PCOS and you're not trying to get pregnant. You've got all the things you want in there, 2 plus the extra selenium. But then you have indium, the mineral indium, which is really amazing for Kathy says, Dr. Kathy says, when I started butyrate last month, by day 2, I got cystic acne, which I haven't had in years. Can butyrate cause this? I don't know. I'll have to look into it, Kathy. I don't know. But I would say it is possible. Is it possible it was a detox? I don't know. I take butyrate twice a day. I've been doing it for months since I read up more about it. I certainly haven't. Nobody's reported that. So I don't know. Maybe you're sensitive to something. Could be. You are a very sensitive woman. Okay. The impact of mineral supplementation. So here we have, anyway, indium helps you absorb all of your minerals that are like chromium is super important for PCOS because it's blood sugar regulating. Indium increases your chromium absorption by 333%, zinc absorption by 79%. And so here we have zinc, selenium, magnesium, chromium, all important for PCOS. Low dose lithium, get to say that again. Thanks so much, Kathy. So again, high doses, lithium acts as a drug accompanied by potentially serious and debilitating side effects. In low doses, lithium acts as a nutrient required for B12 and folate transport and uptake, neuromodulation, and the function of many biochemical processes in both humans and animals. And you can see that there. And I've got a whole page of lithium stuff too. Herbs. There are certain herbs that help. And this is my PCOS support formula that I just formulated like last night as I was doing this program. I had a anti-DHT for women, but the supplemental is not useful for PCOS. So I did a different one, add in the spearmint instead. Spearmint, supplemental. You can see there how these herbs help with PCOS. Spearmint is very good for the hair growth and stuff like that. And then stinging nettle root and Vitex, chaste tree berry, which is progesterone promoting therapeutic effects of stinging nettle in women with hyperandrogenism. So dealing with the excess testosterone and possibly high DHEA. DHEA is very important, but it can be out of balance in a person with PCOS, so balancing the androgens. Effective chaste tree berry, Vitex agnus castus. In conclusion, our results indicated that Vitex extract inhibited downregulation of this in the hypothalamus. Remember, that's where it all happens, the gonadotropin releasing hormone and all of that. Because of the master role of kisspeptin in adjusting the HPG, the hypothalamic pituitary axis, Vitegnus is likely to show beneficial effects in the treatment of PCOS via regulation of this expression. So that's all really good. So then finally, we come to my proposed PCOS supplemental protocol, which is, again, those of you who work with me and you have a sheet like this, it's got your protocol, what I recommend you do. Again, I say this protocol is perfectly safe if you become pregnant. See special notes in the vitamin D section down here where I just have you change your dose. Although more vitamin D from natural sources is beneficial, not just the 400 micrograms during pregnancy and conception and pregnancy. But anyway, progesterone can be continued daily once you become pregnant as a special guard against early miscarriage due to low progesterone until the 14th week, when the placenta will start cranking out 400 milligrams daily. Natural progesterone, like I talked about, okay, feel free to contact with me. Here's my contact. If you have, well, if you're looking at this for your particular situation, you're not a formal client, you want to ask me about your particular situation, I'm happy to answer any questions. And there's the products. You can find them just by clicking on them. They will take you to where they are. The Thorne Basic Prenatal, a lot of my PCOS people are trying to get pregnant, and so I do the prenatal, but you can also do the Thorne Basic Nutrients if you want to. Still has folate, and you're getting folate in the OvaBoost. Glutathione, omega-3, magnesium, vitamin D3, and I tell how you can do that, sodium butyrate, adeno B12, which I didn't put in the presentation, but we want the B vitamins. We want to make sure that you're absorbing it. Some people can't absorb vitamin B12 through the GI tract, so we do a lozenge. I do a lozenge, and I'm definitely not trying to get pregnant. In the evening, after supper, before bed, more magnesium, more butyrate, OvaBoost, 4 capsules at night, and then the lithium orotate. And then for the progesterone, as I described when I was earlier on showing you on that chart. And then the PCOS formula. So this does bring me pretty much to the end. And I'm going to stop my share. I want to thank everybody for being with me. I hope this has been informative. For many of you, it doesn't apply to you, but it does apply to overall hormonal health in many ways. And I'm sure most of you know somebody struggling with this problem, or you will. So please feel free to send it to them. If you're watching for the first time on YouTube or Rumble, there will be a link directly to my PCOS page with this PDF presentation on it in the video description. So if you're watching this right now on Rumble or video, you look down to, or YouTube, you look down to video description, and there'll be a link right there. And you can click on there, you'll be able to see this video, but you'll also be able to get your PDF copy of the presentation that I just did. So thanks everybody. Again, next week, not sure what my topic will be. I'm really enjoying, thank you, Dr. May. I'm really enjoying tackling big things and because now I'm putting them all together. So it's not just a newsletter like, when did Becky talk about this? Let's like get big chunks of big things done. It also really helps me when I'm working with somebody. So my next person with PCOS in my office, I can pull up that PDF, sit that person down. We share my screen. I mean, we look at my screen together, or I can share if I'm doing a teleconference. And go through, and it's all very methodical, and it's all really set up, and it makes my job easier. So again, take care, be well.